I'm going to demonstrate the bunion pad. This is the bunion pad here, which is designed to protect prominences in association with a deformity called hallux valgus. The pad itself adheres to the skin, and in this particular demonstration I'm going to show you a cutout, a cavity, which will allow the bump to sit in this, and the existing felt will be a lot thinner here to protect it from pressure. You'll see it's beveled so it fits nicely to the skin. The reason for using this type of pad essentially provides you with better contact against the skin itself, although these pads are not designed to be used in fragile skin or in patients with particularly poor circulation. You can actually see the pad will stick quite firmly to the skin, although obviously this is a plastic model and it's been on for a couple of days, so you can see how hard it is to get off. It's important you don't actually wear these pads for days on end, because obviously it's important that the skin is allowed to recover. If it becomes wet, it's very important that you don't in fact allow the pad to go back on in that state, otherwise it causes some problems. So you can actually see, having left this on for a while, it does sort of damage the skin, which is quite a useful part of the demonstration. Okay, you need some felt, some semi-compressed felt. You can buy this from pharmacies or chemists. This is the sort of size that you might find you can buy, but if you use the internet you can actually buy sheets, which allows you to make many pads up. It's around about 4 to 5 millimeters thick and has a backing to it which will peel away with an adhesive backing to it. In order to cut this out accurately, you can use card, a piece of card like this, and you can make the shape, which is shaped here as a sort of an egg shape, so it's slightly wider at the bottom here, slightly narrower at the top. Once it's cut out, you have something like this, which should fit nicely around the area. You can transfer that then to your felt, and using a biro draw around the area like so, and then using a pair of sharp scissors. Scissors are best having a sharp edge and a blunt edge. These are kept sharp. These are professional scissors, so they actually are very robust in their nature. Smaller scissors are harder to cut something like felt. So we've got something like this now, and it will fit over there as I demonstrated. The reason for the sharp bit is that you actually need to cut in through the adhesive backing to make a cavity. It is important not to stick the scissors through your fingers, of course. I've done this for a few years and therefore I'm pretty mindful of the damage that you can do with scissors if you're not careful. Peel that away so you're more or less thinning it down here as I demonstrated earlier. And then the bevel is made at 45 degrees. Try to keep the scissors in one position as best you can. Rotate the pad so it keeps it even all the way around. You can now fit the pad to the foot to check that everything is in place. As you peel back, try not to get your fingers onto the sticky back, as this tends to leave grease and it may reduce the stickability. And you can see it down. Push this down flush and that'll sit nicely on there, and it'll fit well into the shoe. It might be bulky for the first few minutes, but this type of felt soon compresses, making it very much more comfortable and less bulky than some of the proprietary pads that go over the top. You can use something like hypoallergenic tape. This is micropore again from the chemist. They often sell them actually in half the thickness, which can be an advantage, particularly with small feet, but it's not essential. This will stay on, probably keeping it on for about 1 to 2 days, providing it doesn't get wet, and as I say, it shouldn't be reapplied. So that's the pad. If you want more information on bunions, please go to my website, which is consultingfootpain.co.uk. Also, you can, if you're particularly interested in learning more about bunions, I've written a book which is called Bunion Hallux Valgus Behind the Seams, and it's a patient journey. There are 3 patients in it, and this is available now through Amazon, and you'll find that it provides a considerable amount of background detail to conservative treatments, including this technique for self-help.